Good morning. I'm going to try to, this is a totally different setup. Look at this with Facebook Live. So I'm just checking out the platform. I don't know about you guys. I guess I'm getting old because I'm not really a big fan of, I don't know, the new Facebook, if you want to call it that. I'm trying to also get my camera set up. So let's see, because I'm kind of looking, if you see me looking up here, I'm looking into the other camera. Yeah, it's a legit technology setup here at the farm. So today's topic, if you have questions, hit me up, just let me know, even if it's questions outside of this topic. But I wanted to talk about why runners get injured. I'm sure that a lot of people have a pretty good guess why a runner gets injured, but some of the things that are the highest correlations to injury for runners may be surprising to you. So I taught a seminar to mainly students and practicing chiros and PTs, I don't know, I guess that's been almost 2 months ago now, or yeah, a month ago, sorry. COVID time, it's different than real time. It's like, yeah, it's got a relativity thing in there. And this was one of the things that we talked about. So the biggest correlate, which this surprised me because I don't like to admit that this is one of the biggest correlates for running injuries, is limb asymmetry. Now, we'll talk about this quickly because we can get into the weeds on this. I just had somebody that came into my office yesterday from an ortho. The ortho was talking about pelvic obliquity and leg length difference, and we had a good laugh that was what they were being told from an orthopedic doctor. So leg length, limb asymmetries, not just leg length, limb asymmetries are legit. There's nobody in the world that's perfectly symmetrical from a structural standpoint, but how we accommodate for those structural asymmetries or inequalities, it makes all the difference in the world. Now, some asymmetries are too much to accommodate for, and that's where you're going to see, in my experience, people show up with chronic injuries to, it doesn't have to be one side versus the other, you know, it's always the short side of it, but you're going to see people show up with injuries fairly early on in their life, and that may be their history if you're seeing them as an adult. But limb asymmetry is also, it comes into play of functional changes in limb asymmetry, that we're starting to use something different over time, or we've had a surgery and then now use that hip or knee differently. And then you'll see that actually become apparent. It also means limb asymmetry of movement. So if I have less hip extension on one side or less knee extension on one side, those things also matter. Second is gender and age. Hate to say it, but females get injured about 10% more than males. And the younger and the older you are, the more you get injured. I think that should make sense. Nowadays, if you kind of take just the last 10 years, you're going to see that it's far more youth athletes are getting injured running. And I cringe to use the word athlete when we're talking about those runners that get injured. And I'm not saying that in a mean or demeaning way. It's just the truth that kids are ill prepared to go run even, you know, simple like 7th, 8th grade cross country most of the time. BMI. This one I would like to get more data on, but this was the breakdown of a literature review. I think it had 254 articles total. Because I have also seen standout articles where BMI was almost like a protection or an overtraining shield for future running injuries, which should make sense, that if my capacity is up here and my load or my need is down here, as I lose weight when I run, I may be better off. But also, if you're a bit heavier and you're trying to do high mileage or, you know, slamming down hills, we could also see how that could, you know, just create too much load. And one of the biggest factors for injury overall, when we don't look at just these statistics, if we looked at like what do we see in the clinic, is the inability to reduce impact, which isn't on this list because they're not looking at the biomechanical properties of each individual. They're looking at kind of population statistics. But we're going to talk about that here in a second. But BMI would be affecting that for sure. Experience. Again, you see novice runners have the highest injuries by far. You're going to see about 80% of novice runners, that's anybody under 1 year of running, get injured. So now we have to talk about subcategories of injury. Why does the novice runner usually get injured more often? Well, their tissues, bone, tendon, ligament, muscle, low on the list, hasn't built tolerance. So there's kind of this, ideal world where we would get into some sort of endurance activity early in life. My belief is, if you look at some of the most prolific athletes from the endurance realm, all of them started swimming, which was a low impact activity where they could build mitochondrial density, become really efficient at using a fat adaptive state to kind of go along and go strong. And then they get into other activities. That's not, has to be the rule of thumb, but that's what you see a lot of the times. So if I built this mitochondrial density and now I have a big aerobic base, I can take that engine and start to build tolerance in my tissues when I start to load with more volume, more intensity. What happens with most novice runners? They don't have an aerobic base. B, they just start tacking on a bunch of miles, and then they run into this competition between aerobic efficiency or aerobic endurance and muscular endurance. And when those two things butt heads, you're usually going to show up with some sort of musculoskeletal injury. Not because of how you run, your form, weakness. Literally, you're using muscular endurance to trump aerobic endurance. And then volume. We've probably all, if you're a runner, you've heard the 10% rule that, no more than 10% increase in volume or speed / intensity week over week. That 10% rule, probably a pretty good rule for novice. Now, it's not a great rule if you're, let's say, an experienced runner that's had to take a prolonged amount of time off because of injury, because you have an aerobic base built. So the 10% week over week volume is more about how much time did you have to take off. And I call this the NBA off-season syndrome. You see somebody like LeBron James and a lot of NBA players now don't really take an off-season because they realized that off-season allowed their tissues to become deconditioned, not muscle, but tendon and ligament. And then what do we see a lot of basketball players show up with? Things like patellar tendinopathy, Achilles tendinopathy. So it's allowing your tissues to stay in this kind of high capacity state without losing aerobic endurance. So let's say I get injured, I can't go run. What would be a great idea? Well, to do some strength training to keep those tissues tolerant, offloaded endurance activities, because low-level aerobic conditioning absolutely improves inflammatory markers that would probably be associated with most injuries. So there's a lot we can be doing if we say we've taken things off. But then when you get back into it, it's what do we actually need to build? Do we need to build, better leg speed, better turnover? Do we need to tap back into aerobic base training? Like, are we going after building a little bit of VO2 max up front? That's where it gets more into the coaching realm. But those are the biggest factors listed, but the biggest factor is prior injury. So if you come into your run training with, really nasty ankle sprain 6 months prior, this doesn't mean that we're saying you're going to have another ankle sprain. What it means is you're setting your body up to compensate for the way you're moving around that prior ankle sprain that could show up anyway or anyhow, right? Knee, hip, neck, back, doesn't matter, because your body starts to, it's a highly adaptable, it is a very dynamic system, and a dynamic system can adapt, and that's what it's meant to do. And when we adapt, we use other tissues and we override their tolerance, right? We use a hip more than we would use it normally because the ankle's not doing its job. So again, that tolerance capacity issue. And just to, again, if you guys have questions, let me know, but just to end with here, talking about this inability to reduce impact. So if we took all of these things, right, a prior injury, we could see how that kind of leads to maybe your ankle can't dampen load as well. Your volume, you haven't built the ability to be strong enough via aerobic and muscular endurance to reduce impact. Experience, I don't know if we could make a direct correlate, but as you get to be a better runner, we see better form fall into place. There's this kind of Goldilocks zone that the thought process, if you run enough miles, that you kind of fall into your normal gait without really having to be trained too much. BMI, obviously going to affect your impact. Gender and age, things like Q angles, the angle from your hip to your knees in females, strength, things like that do matter. And then limb asymmetry, if one side is going to hit the ground sooner, we have to change foot position to accommodate for some sort of asymmetry. All those things, in my mind, lead to one thing: how well do you reduce impact? And we talked about this in the clinic I taught, that I call it anti-impact reduction syndrome. that's what I think I'm treating most of the time with runners. I mean, that's not like, oh, hey, we're going to go do all the same stuff. Like, how well do you reduce impact? Because if we had to get somebody to do one thing to try to reduce injuries or limit injuries as best we could in a runner, it would be, hey, you need to offload your musculoskeletal system with every step as much as you can, because when we're running, we have anywhere between 2.5 to 3 times our body weight coming back up our body with every step. So that can be a massive payload over the course of a 5 mile to a marathon run. So I hope that helps somebody understand why injuries occur and realize it's not usually what you think it is. Did you hear me talk about shoes? Did you hear me even talk about form? No. Did you hear me talk about whatever new trend or fad of, 3 inhale for 3 breaths, exhale for 2, or your cadence? Like, no. Like, these are the big things. I think the biggest is how well do you reduce impact, which is multifactorial. But next time you're injured, you're getting advice from somebody, take these things into account and like start to pick up in your mind, are these things being addressed, right? Or is it just, hey, it's that person's opinion, whether it's coach, physician, or Google, on what needs to be done. Hope you guys learned something. Let me know if you have questions, and I'll see you next time.